Hi everyone. We are Meditive. So we focus on lifestyle medicine and preventative medicine. So basically, we explain you how can diet and lifestyle prevent and even reverse diseases. There are different aspects of preventative medicine, different aspects of public health. But the one aspect that we're going to focus today on is nutrition and the food system. So Riley, I know you're going to soon be graduated from UC Berkeley and you have a background in public health. That's why we decided today to have you on our podcast. I'm very, very excited to have you. So first, can you introduce yourself? Tell me about a little bit about your background and what you know about public health.
Yeah, absolutely. So I'm a senior at Cal this semester. I will be graduating this semester actually with a degree in public health and a minor in geospatial information science and technologies. Basically, my background in public health has extended past the last 4 years in Cal and even into my high school, where I did research on bacteria and published that and have been involved in public health for a long time. So I'm glad to be here today.
Nice. Thank you very much, Riley. So can you explain what is public health and how does it relate to preventative medicine?
Yeah, absolutely. I think so. Public health, we like to have this expression, there's an upstream versus a downstream approach, right? And so basically, if you think about a stream and you think about boats coming down a stream and say every boat has water in the boat as it comes down the stream. Doctors may be downstream figuring out what's going on, how can we fix these holes, whereas public health experts are upstream trying to figure out why are these holes being caused in the first place. So the best way we can describe public health is basically anyone who is up the stream trying to figure out what causes these issues in society in the first place and how can we create a stop before it ever even happens. And I think that that's related to preventative medicine because basically those are very similar, one and the same really, where preventative medicine works to make sure you don't get sick in the first place, say you're eating healthier or whatever the case may be. And I think that that is very similar to a public health approach in your personal life.
Yeah, and actually that's what we explained to you guys in Meditive on how to change your diet and lifestyle to prevent the disease to occur. But what's really interesting is that it can prevent, but it can reverse some disease, some chronic pains. So that's why it's interesting also to have a combination of Western medicine, holistic medicine, this upstream and downstream approach, because sometimes you need the medication to fix your problem, but it's not enough. And you need to pair this medication with a change in lifestyle and change in diet. And so the topic of the month is nutrition. And so we're going to explain how nutrition can do a lot to your health and how you can improve your health and reverse disease in knowing what good nutrition is. So I'm French, and Meditive is actually a platform both in French and in English. We're gonna do both, but I believe that public health is very different in these two countries. So, what are the differences between the two countries?
Yeah, absolutely. I'm sorry I can't tell you in French. I think that that would probably be so fun. But so
I'll
public health.
translate. Don't worry.
Yeah, thank you. Thank goodness. You know what? Maybe you should start coming to all my lectures and then we can do some in French, some in English every time.
Sure, that'd be great.
So, excuse me, basically the definition of public health stays pretty consistent worldwide, but it definitely gets applied to what healthcare system each country has. And France has a very different healthcare system than the US. The US famously has one of the most complex and inefficient healthcare systems in the world, where it costs a lot of money and we do not have a really healthy population. Whereas France has universal healthcare coverage. And basically, the role of government in France in healthcare is basically they provide healthcare in France. It's a national responsibility. The Ministry of Social Affairs, I believe, Health and Women's Rights is responsible for defining the national health strategy, and it sets and implements government policy for public health, as well as the organization and financing of the healthcare system. So having that kind of all standardized within the government is, as basically a general statement, significantly more successful than the US, because all of our healthcare is all over the place, all kinds of privatized, and then there's Medicare or Medicaid, which is incredibly hard to navigate, and a lot of people fall through the gaps of our healthcare system because we don't have any kind of standardization or stopgaps that look out for people who may not get that healthcare.
Yeah, yeah, and this aspect, you're right, because this aspect of public health is not only preventative medicine, but it also the fact that everyone can have this present of preventing the disease to occur in the first place, and that comes with having the monetary means to do that. And it's true that in France, it's very different that what you guys have in America, and that's why there are disparities between communities. Do you actually so coming back to this topic of nutrition, do you think that there are disparities specifically in America when it comes to nutrition?
Yeah, absolutely. I would say that there's significant disparities no matter what geographic region of the US you may be looking at. There are huge, huge disparities between food security and insecurity, but also I want to bring up the topic of food sovereignty. So, food insecurity is when people may not have access to the minimum nutrition you would need in a day. And so that runs rampant across the US. And that's really kind of an issue of supply chain and also funding. So, for example, in low income communities, there may not be a Whole Foods. And even if there is, people who reside in low income communities may not be able to shop there and they may need to shop at the bodega. And then if they're shopping in a bodega, the freshness of the food may not be as available, right? You might not be getting that full nutritional value. But the other aspect of nutrition in the US that is really, it needs to be kind of looked at on a broader scale is food sovereignty. So, food sovereignty is making sure you have access to culturally appropriate and nutritious food. And that is a really massive issue for a lot of Native and Indigenous peoples in the US. So, living on those reservations, they don't have access to any kind of like culturally significant food. So, that can also really impact health.
Yeah, yeah, that's very interesting. And do you feel that in America, the government is doing enough about nutrition policies to encourage citizens to opt for healthier options?
Right. I think that we are trying to make strides every once in a while. I think that you do see a policy that seems progressive and it seems exciting. For example, I think the last thing I personally saw that I thought was a really great step in nutrition was Michelle Obama's anti obesity campaign, trying to implement healthier foods in schools. But I think that ultimately the US government is really, really reliant on lobbyists, and it's really easy to change policy if you have enough money. So I think that the US does a really poor job of valuing its citizens' nutrition over its policy and its money, if that makes sense.
Yeah, yeah, definitely. And that's why we decided to come up with Meditive, because we believe that, of course, the government has to do everything to promote healthy options in the stores or to, make healthy food less expensive than processed food, which is not the case today. Yeah, processed food is very cheap compared to whole grains, fruits, and vegetables. Um, and so that's why we decided, me and Shannon, who is my co-founder, we decided to start this podcast just to educate people about what's healthy foods, and especially not eating healthy to like look a certain way or to look like this model. It's just eating healthy food to have good health, to be healthy, to have a healthy body, to have a healthy mind. And that's what's important. And I think that's one step, working on our community level to spread the message. That's what we can do. And it's a small thing, it's a small step. It's just, we're gonna interview a lot of people, a lot of doctors that talk about it. It's just a small step of trying to educate everyone around us, because it can really change lives. So that's what
Yeah,
we're
I
doing. And
absolutely. That's amazing. I love that. And one more thing I want to emphasize in that same vein is I know we talked about this in class, but um, McDonald's or fast food in general, they have such a media hold on the US as well. And even kind of globally, they have done such a good job of telling you that their food is convenient and cheap, when the reality is you probably could get a salad at the grocery store for way less than a 10-piece nugget meal, but they have
yeah.
done such a good job of telling you like this is convenient, this is easy, this is kind of healthy. you could do
Yeah.
it.
And that's what we're going to show you also at Meditive, how to eat whole foods, healthy foods, but on a low budget, because it is possible. You just have to know the tips and tricks and be organized. And you might think it's more expensive or less convenient, but it's just a matter of like being organized and know where to shop and know how to do it. So that's what we really do at Meditive. It's tell you not only what to do, but how you do it. How do you implement? And so that's something we're really working on, because it's true, as you mentioned, that there are privileged communities that have easier access to healthy foods, and there are these lower income communities or communities of colors that don't have access to healthy foods, and that's terrible. But what we see also, it's this surge in obesity of people being diagnosed with that are diabetics or pre-diabetic, and those are not specifically people that come from low income communities. They can come from privileged communities. So how is that, like, people that live in privileged communities that have the money to afford healthy foods have disease that are related to poor nutrition? And so I think it's just because people are not educated, like they're not educated enough. What do you think, Riley, about that?
Yes, that is exactly what I was going to say. Having gone through the American public education system for my entire, I guess, pre-K through high school career, I will say there's very, very little education about how to eat healthy. And even more than that, there's very little education about what are the effects if you don't eat healthy. So I think that that lack of education is so common no matter what your financial status is. And maybe people who are of a higher financial status have that capability of seeking out education on their own, whether that be hiring a nutritionist or hiring someone to design meals, or even meal companies like HelloFresh or whatever the case may be. But I
Mhm.
think for people in lower income communities, it is really, really challenging to access any form of education about what is the appropriate way to eat food and how to fuel your body healthily consistently.
Yeah, definitely. And especially, I don't know if you've experienced that, but when I was doing my own research of like what is a healthy diet, the only thing that I came across were like how to count calories, how to eat to be skinny. And actually, it's not what I wanted. I just wanted to know what's a good way of eating. It's not just because being on a diet, it doesn't work. You're frustrated. It's all about restriction. And when you try to like see what's a healthy diet where you have all the nutrients that your body needs, then it's really hard to access and to know the real information, the information that is backed up by science, not by this influencer that did something and it worked on her. So yeah, that's why also we
Absolutely.
yeah, that's why we did Meditive, because we want people from every kind of communities to have free access to the information, and information that is backed up by science, so we know it works.
That's so
That's
impressive.
what
And
we're
I'm
doing.
really excited to hear that somebody is out there trying to make that work, because I think that that is so important. And I wish you guys the best. I'm so impressed
Thank
by
you so
the
much,
work
Riley.
ethic and the mission. And I'm very excited to see where all of this goes.
Thank you so much. Thank you. And also, yeah, just to finish on that, on the difference between America and France. It's true that culturally France is healthier because we're less sedentary. We don't need our car to do everything, so we can easily walk to go grocery shopping. Even when you go to restaurants, the portions are smaller. So it's just a cultural thing when people are healthier. But on the other side of the spectrum, when you look at America, it's true that maybe culturally they don't have incentives to be healthy. So just on a side note, I remember the first I'm currently studying at Berkeley, and so when I arrived at Berkeley and I went grocery shopping at Safeway, I wanted to buy quinoa. And so first, before finding the aisle where they sell quinoa, I had to go through this aisle of like all the chocolates and all the processed foods, and when you want to buy milk, and then the milk, but then so there's the fridge where the milk is, And then on the fridge, they would sell cookies. So of course you want to have cookies and milk, so you're just incentivized to opt for the on a healthier choice. And so I wanted to buy quinoa, just plain quinoa. And then I had a hard time finding plain whole grain quinoa. I had to like go through like all these different types of prepared and packaged food before finding quinoa. Whereas in France, it would be obvious. You would just have the quinoa, the rice, the pasta, and nothing is processed. So I think that's harder in America. But on the other side, in America, I think today a lot of doctors talk about the importance of preventative medicine, of how nutrition is very important for your health and how it can reverse disease. And a lot of doctors have Instagram accounts even, and they write books about it. Whereas in France, it's truly something that we're missing. That's why we're at Meditive, we're going to do both we're going to provide the information both in English and in French, because we want to take advantage of the information that already exist in America, and we want to teach and educate the French population about it. But also we want to use this French culture, this healthier French culture, and educate also internationals and Americans about how to have a healthy life, to be happy. That's just it. That's it.
I absolutely love that. And I think that'll be nice to kind of have the opportunity to share what we know, right? And learn from each other, because I think that definitely if there was a way to kind of combine what we've got going on, maybe there's something really successful there. So I'm very,
Yeah,
very see what you guys come
definitely.
up with.
Definitely. And I think, yeah, we can complement, like each culture can complement each other. You talked about the differences of communities that have different types of foods and eating habits. And we can learn from this. There's no one good eating habit, and we can learn and pick what we like and what works for our body. And that's very, very enriching. So thank you so much, Riley.
Yeah, thank you.
Last question. What's your favorite healthy food?
Ooh, you know what I've always loved is, I guess it depends on what you call healthy, right? There's different variations. I feel like a salad is way too easy. It's too much of a give me. So my original answer was an arugula salad, but
Oh yeah,
I think,
I love arugula.
right? I don't know what it is.
It's
I think it's the
so
best
good.
lettuce.
For
An
me,
arugula
it's
salad.
like a restaurant, it's a restaurant
Yes,
salad for me.
yes.
Yeah,
I always feel so, my salads are so elevated when I use arugula instead of anything else.
definitely.
But I also
Yeah.
love any kind of like fish, I think is an amazing thing to prepare, because it's really hard to prepare fish unhealthily at home. It's really
Yeah.
hard to sear batter and fry fish at home. So if you're going to make
Yeah.
fish at home, usually it's pretty healthy. And I think that that's a nice way to get a lot of protein while still keeping in mind a lot of like the sustainable values that come into play when you're talking about the importance of nutrition, but also issues with the entire food system.
Yeah. Yeah, definitely. I think my favorite food as snacks, I would say nuts. I love nuts, like all kind of nuts. When you toast them, it smells very
Absolutely.
good in the house.
Yeah.
And yeah, just nuts, you don't have to do anything, you just eat them, and it's just healthy, good fats, and it
And
sustains
I
you.
will
So
say, throwing a little salt and vinegar over almonds,
oh
so
yeah, I
good,
should try that.
because it's just like salt and vinegar chips, and you have the same, like you cannot stop eating them, but it's
Yeah.
not potato chips. Yeah,
Yeah, and
absolutely.
it's very good for your health. Yeah.
Yeah. I need to start
Thank
buying more nuts. You've convinced me.
Yeah, yeah. And actually there are some ways. So nuts are pretty expensive, but there are some ways, and we're gonna explain all of that in Meditive. How do you like to buy in bulk? Because if you buy in bulk, it's way cheaper, and so yeah, yeah, we
Nice.
should
Well, I
try
can't
that.
wait to hear all about it.
Thank
Can
you
I
so
help you
much,
with
Riley,
anything
for
else
joining.
today? That was it for today?
Yeah, that's it for today.
Awesome.
Thank you so
Awesome.
much. Next episode,
Yeah.
we're gonna have actually a geneticist that
Nice.
switched to so he was eating, not unhealthy, but he had a medical issue, and he became 90% whole food plant-based. He
Ah,
switched to a Mediterranean diet, and he's gonna explain how important it is for
yeah,
overall
I've heard
health.
amazing things about the Mediterranean diet. So I
Yeah,
actually, that one to me. I can't wait to tune into that.
definitely, definitely.
All
Thank you
right,
so
Sarah.
much,
Thank you
Riley.
so much. I'll see you in class.
Thank you. Bye.
All right. Bye bye.